Hello everybody, hello, welcome to our live Facebook session here at Croydon Vision. I hope you enjoyed last week. It was Glenn and me, we were talking about shopping online and banking and sharing our ups and downs and our experiences about how we kind of, our solutions, I suppose, about sort of adapted credit cards and talking ATM machines and our sort of adventures of shopping online with sight loss. So I hope you enjoyed it and learned a few tips from it. And sort of today we are trying something new because we have Hussain. Hello, good afternoon, Hussain.
Hi there, Odette. Hi, everyone.
And although Hussain appears on your camera on your screen, he's actually not with me in the recording studio. He's in his office, and we are trying to also get that Hussain can actually see me, rather so Catherine has very cleverly linked up the camera and the camera from her laptop. So let's see if it works. So if it all works, if you see us very well, if everything seems okay, do type a little okay in your comment. All is well. And like that, we know that the sound and the picture, everything is working for everybody. So today we're going to be talking, we've been asking some questions to Hussain. Some of our members have sent in questions in advance, and we'll just chat. And please don't forget to share, to share, tweet, do all the social media to promote our Facebook Live events, and do write in your comments, your questions. Catherine is here today with us. Hello, Catherine.
Hello, Odette.
And she'll be reading out the questions now so that we can answer them. So Hussain, hello, and thank you for joining us this afternoon. And
No, thank you. Thanks for having me.
before we go into the nitty-gritty of talking about eye health and Moorfields Eye Hospital, it'd be really nice if you could maybe tell our viewers a little bit about yourself, who you are, and maybe what inspired you to be a doctor that sort of looks after our eyes. And do you mind sort of telling us a little bit about yourself?
No, not at all. So my name's Hussain. I work at Moorfields Eye Hospital. I'm an optometrist, not quite a doctor, but an optometrist. I believe you've had some optometrists on your Facebook Live sessions before. So the majority of you will know that optometrists, sometimes we are known as opticians, work in the community testing the eyesight of patients. I work slightly differently. I work in the hospital setting rather than the community. And my role at Moorfields is that I'm the lead optometrist for optometry services in Moorfields South. So I have a team of optometrists that work at all of our sites across Moorfields South London. We have different clinics that we look after. We have our low vision clinics. We have other clinics as well, which are optometry clinics, like medical contact lens clinics. And some of my team also work in the actual medical clinics, so like the glaucoma clinics, the retina clinics. So we do a whole host of different jobs within the hospital service. And I guess what inspired me to go into eyes, to go into healthcare? It's a good question. I think, unfortunately, it's probably quite a boring answer. I was always a bit of a science bod at school, and I loved it. And it sounds sometimes a little bit cliche and a little bit corny, but I was just really kind of hooked on science, especially biology when I was studying. And then I did some work experience actually as a student in a local optician's practice. and I just loved it. I was fascinated by it. I mean, sight is so important. It's one of our most important senses, and to be able to look after it and treat patients with sight loss and diagnose them and help see people function and see more clearly. Always held appeal to me, and that's what took me down the path of studying optometry as a degree, and then here I am today.
Fantastic. So would you say that your work experience was really a kind of a landmark for you and really sort of pushed you to go in that direction?
Absolutely, yes. No, that was actually the key moment for me.
Fantastic.
And so work experience is so crucial for our young people who are studying, to give them some direction and a flavor about what they want to do. And so that was what the turning point for me is, what clinched it.
Fantastic. And I think that we had somebody from Access to Work from the DWP talking to us and saying that they now give support for people with sight loss to do work experiences as well, which they didn't used to before. So work experiences is a great kind of motivator and opens you to the work experience is exactly what it says on the tin, isn't it?
Well, absolutely, and young people with sight loss should absolutely have that same access to work experience that people with normal eyesight should have. And I'm glad that Access to Work have recognised that and are allowing young people with sight loss to do that.
Yeah. So coming back to our to your work. So what I've sort of realized that there is a few low vision clinics outside of the hospital, out in the community, and why would a hospital decide to do that? What does it? How does it help hospitals or patients for that matter?
Yeah, I mean, the benefit is both with patients and with hospitals, really. Traditionally, low vision clinics have always happened and have always been held in the hospital setting, and have always traditionally been performed by optometrists, and that's because one of the crucial elements of a low vision assessment is sight testing for glasses. That's just one component of it, and so that's why it's always traditionally been done in the hospital, where you have a hospital optometry team to deliver that service. But actually, as we've discovered, as the needs for eye care and the demand for eye care has kind of grown exponentially over the years, and unfortunately, number of people with sight loss has also grown. With our aging population and age-related eye disease, we at the hospital just can't cope necessarily with the demand, and so we need to be innovative, and we need to think about new ways of how we provide low vision care and low vision clinics. And the benefit of holding them outside of the hospital is that you can, and this is where the benefit for patients comes in, is that you can provide the care closer to the patient's home. Hospitals are also often a very daunting place to be, and not always conducive to the kind of environment you want when you're trying to help rehabilitate a person with sight loss and come to terms with their sight loss. And that's why sometimes community care has that benefit.
I found it. I found that the wait, for example, at the Moorfields Eye Hospital at Old Street, I find the waiting room so large that I can't see when somebody comes to say it's your turn. And so you're sitting there very nervously, hoping you won't be forgotten and that you kind of, you won't miss your turn. So I can well understand that, yes, the low vision clinics in the community would be kind of a more friendly environment for patients.
Absolutely, and and low vision care you can train people to deliver low vision care. There's no reason why an optometrist has to provide that care, and that makes it much easier to get people, to get a workforce that can do that for you. But so yeah, I think that's the way things are going and the way we're moving forward. There's always a place for hospital provided care, but we should see people in the hospital for what we need to see them for, and that's treating their eye condition.
Yeah, like surgery and that kind of thing.
Absolutely.
Yeah. And Hussain, just for viewers who might not know exactly what a low vision clinic is, would you like to explain to us a little bit what happens in a low vision clinic, just briefly?
Yeah, absolutely. So, I suppose you could term a low vision clinic a support service. And so, for patients who are diagnosed with sight loss or have sight loss, what the low vision assessment helps to do is helps to rehabilitate the patient visually in that respect, and allows helps the person to help come to terms with their sight loss, and helps maximize their ability to use the vision that they have as most effectively as possible. And a big part of that is through the use of optical aids and magnifiers, and particularly when it comes to reading, because we find that what patients with sight loss, especially central sight loss, often experience is difficulties with reading. And really, it's to trial low vision aids and to train patients on effective strategies to maximize the vision that they have, in order to be able to be a bit more independent.
Yeah. I mean, I've got Stargardt's disease, so I've lost the center of my vision. So I went to the low vision clinic, and I was given a handheld magnifier. So I was taught how to use it. And also some binoculars. I found that if I want to try and see, if I go to a show, a theatre, or if I want to see the number on a bus, or the name of a street, or the number on a door, I need to use my binoculars. But because I have the loss of central vision, I have to still do eccentric viewing. I still have to sort of shift my eyes a little bit sideways, even while using them. To sort of try and sort of read a bit.
And that's part of what we do. So it's not just, helping to teach someone to maximize their vision is not just about using optical aids like magnifiers. It's about using viewing techniques like eccentric fixation and eccentric viewing.
Yes.
To enable them to see a little bit more effectively, to get some of that independence back. So that's what we work closely with other professionals like eye clinic liaison officers to signpost. The ECLOs. So we work quite closely with the ECLO team to help signpost patients to other resources and to other services that could benefit them.
Fantastic. And just Hussain, let's ask Catherine if there's any questions. Any comments or questions at this stage, Catherine?
Not at the moment. I was just saying that here at Croydon Vision, we also know about eccentric fixation and eccentric viewing and steady eye. So if it's something you have been taught but haven't quite remembered it, we can help you just remember how to do some of the bits and bobs.
Excellent. So Hussain, if somebody felt that maybe their eyesight has gone a little bit down and their magnifiers are not working so well anymore, and they think they might need a stronger one, how do they get in? How do they get an appointment with a low vision clinic? Do you know what the process is?
Yeah, absolutely. So a lot of our patients are continue to have their care in the hospital under their core service. So, for example, a glaucoma patient will still be under the glaucoma clinic. Yeah. And if ever a patient wants to go come back to the low vision clinic, we're more than happy to see them. They just have to ask their clinician, their doctor, their medical professional who sees them in the eye hospital, in the eye clinic, to refer them back to the low vision clinic. It's important to remember, you don't necessarily have to wait for your appointment to ask for that. You can contact us, you can email us, you can call us to say, look, I would like another assessment in the low vision clinic, and we're happy to see you.
Oh, fantastic.
I have just had a question come in and it's related to that. And the question is, what is the current waiting period or waiting time to have a low vision for the low vision clinic at Moorfields?
That's a very good question, and it's all changed because of COVID, and because of COVID and how that has affected our ability to see patients and the way we see patients. Everything is being everything. We're starting from a clean slate, if you like.
Yes.
Actually, the current situation is better than it was before COVID. We can sometimes get people into a clinic within about 2 months, 2 to 3 months, which is a long time. But we are constantly striving for ways to get that down, and we're looking at the way we work and trying to come up with innovative ways to try and see people sooner and get people the help they need faster. So it's not always what we would like it to be. But we are always trying to get that as low, kind of as down as we possibly can.
Thank you. And Hussain, what would you say to somebody who might have their appointment cancelled and rescheduled and cancelled again, and they're getting worried? What would you say to them? What should they do? Should they still contact the hospital again and say, can I please have an appointment, so to speak?
So no, unfortunately that's happened a bit because of COVID and how it's affected what we're able to do. There's lots of useful points of contact. I mean, Moorfields has set up an email address specifically related to COVID bookings, and you can email that. And then someone on the other end of that email inbox will try and figure out what's happened with your appointment.
Oh, that would be fantastic. Would you be able to, I don't know if you have it at hand, maybe we could type it in the comments. Would you have it?
Yes, I don't have it to hand, but I can certainly provide that information.
That would be fantastic.
For viewers. So we have an email address where patients can contact to find out what's happening with their appointment. We have a Moorfields direct helpline, which is nurse-led, that people can contact if they're worried about what's happening.
That is really helpful, because you can well imagine that we've had a few of our members that are worried. And I think it is a worry, because you don't know if it's going to affect your eyes, if you're going to lose sight, if it's... Sometimes as a patient, you're not sure kind of how urgent your care is, really.
Absolutely, and that's understandably a concern for lots of patients. I mean, we've tried to create points of contact within Moorfields that patients can use to find what's happening with their care. I think the opticians are also a good resource, because especially in the Croydon area, we're fortunate in the Croydon area that Moorfields has a good link with the local opticians.
That's good to know. That's really good to know.
And so if anyone feels like their vision has changed and they're unsure, exactly as you said, on how urgent that is, please go and see your optician. Your optician they're open, they can examine your eyes, and then they can get in contact with us and refer you back to us if necessary. So don't feel like because you're under Moorfields you can only see Moorfields. You can definitely see your local optician, and like I said, the links are quite good. They can refer you back to us, and then we'll see you urgently if there is a problem that they have detected that needs immediate attention.
Excellent. I think Catherine has put something down. Catherine, have you put something?
Yeah, well, I had a comment from Carol, and it was just before you started asking your question. And it's exactly the same principle. She says she's had an eye appointment that was cancelled in September last year, and she's very worried. They said they'd let her know what was happening. So Hussain, thank you so much for your feedback. Carol, I hope that Hussain's feedback comments has helped. I've also, whilst Hussain was talking, I have found an email address. I've popped it in the comments. It's moorfields.covid19 booking inquiry at nhs.net. I'm sure Hussain will let us know if that's the wrong one. And we'll update it on the comments, and if you have any queries, worries about it, just contact us directly and we'll let you know what the correct email address is.
And that is absolutely the correct one. So thanks, Catherine. That is,
yeah.
I didn't know off the top of my head, and I was literally just trying to find it as.
Catherine beat you to it.
You beat me to it. So that's exactly the right email address to use.
Thank
Please
you.
do use that email address and contact us if you're a bit concerned about cancelled appointments.
And maybe we can put it in our Talking News as well, because we have some of our members will not be on computers and using Facebook. So we'll make sure our members on the Talking News have that contact as well. Sometimes they have family that can then help them send the email. So that's great. Now, Hussain, another thing I wanted to talk to you about is that I know Moorfields Eye Hospital in Old Street is planning to move next to King's Cross. I was part of the sort of consultation. I was sort of giving sort of my views on what I think an eye hospital should have, shouldn't have, and things like that. So do you want to sort of maybe update us, tell us a little bit about the move, about what's planned? Maybe our viewers don't know about it.
Yeah, no. So just to give everybody a little bit of a background. So Moorfields will be moving to a new site in King's Cross, which is a little bit further north, but not too much. So it's just slightly north of King's Cross Station. It's about a kind of half a mile from King's Cross St Pancras Station, underground station. And the reason for it is that, I mean, as I touched on before, the demand for eye care is growing. With an aging population and with an age-related sight loss and the incidence of eye conditions.
And I suppose you're saying that now with the advancement of medicine as well, there's more treatments. And before, people, if they had certain eye conditions, that was it. But now there are treatments, so that also creates, in a sense, more business. I say more business for you, but more interventions. Let's put it that way.
There's exactly, and the demand for eye care is going up, and the provision of eye care is going up.
Yes.
Exactly the reasons you've mentioned, because newer treatments are available, and that's partly because of research. Moorfields is very actively involved in research, and to be able to meet those demands and to be able to commit to make our research commitments, the building that we're currently in, which is 120 years old, is becoming a little bit difficult to maintain and keep up with what Moorfields is trying to aspire to and trying to achieve.
Yeah.
And so we've decided that we need a new purpose-built building which combines the elements of clinical care, world-renowned research, and education, because we also need to commit to and prioritize kind of teaching the next generation of eye care professionals. And so this new purpose-built building in King's Cross will allow a more integrated facility to kind of integrate all those elements of eye care, really. And so with Moorfields, it's a collaborative project with Moorfields Eye Charity, with Moorfields Eye Hospital, and the Institute of Ophthalmology, which many of you may not have heard of, but the Institute of Ophthalmology is run by UCL, University College London, and they do a lot of great research into eyes and eye health.
Yes.
And between the three of those organizations, we have come up with a plan to move our site to King's Cross. The project is called Project Oriole, and we passed the stage in February last year. It was all approved by the NHS after a long consultation process, which the public were invited to be a part of. So thank you very much, Odette, for contributing to that. And so, yeah, now plans are being drawn up, and it's very exciting because we now actually get to see from these plans what the new hospital might look like.
Fantastic. And sort of when is it when is the move, when can patients expect, I mean, I know you can't really say for sure because you just never know, but when is it planned to open, more or less?
Oh, I think we're still a few years away.
Yeah.
Again, off the top of my head, I can't remember the year that we are. But that we are planning to open. But there is a whole website dedicated to this project that is for the public to log on to get more information. And there's ways to get involved as well.
Excellent.
So. Again, that's maybe something that we can type into.
We can do a whole other Facebook Live on the new Moorfields.
Yeah.
Yes. Well, thank you. That's really useful. I mean, for us in Croydon, to go to King's Cross will probably be quite easy because we go on the Thames Link and we're straight there. So it might even be a better sort of place, sort of location for Croydon residents. So there we go.
Rest assured, all of that is being looked into. I mean, the accessibility is one of the priorities for the people who are involved in designing the new hospital. And the accessibility, especially for our patients who have sight loss. And
a lot of people mention the green line, the line that goes from Old Street Station, and you kind of follow it along the pavement to the hospital. So people were very keen that there'd be some kind of line to follow.
So we're hopefully going to employ all of those strategies, all of those little kind of useful and effective. We're going to try and obviously translate that over to the new hospital when it eventually opens.
Okay, excellent. Now, another thing, Hussain, another thing is you were talking about the school, the research, and the kind of treatment of patients being in one building, and it made me think that, well, I've got Stargardt's disease, and I know that for the moment there's no treatment for it, but as a patient, I'm always sort of going to the Stargardt's network. I go to the Macular Society conference. As a patient, I kind of keep myself informed about the latest research, and if there's any kind of if you need guinea pigs, so to speak, or if you need feedback from patients, I'm always there to try and help if you want the development of the understanding, the development of research. And what would you say to patients? Because I think that sometimes people think that, oh, well, I'm a patient at Moorfields, surely they should contact me if there's a new treatment. Can people expect that? Or what would you recommend?
It's a good question. I think, unfortunately, again, it all ties back to the demand for eye care and the sheer number of patients that we have. And I think as much as we would really like to be able to stay in contact with patients even after they've been discharged to make them aware of any new treatments that are available, sometimes because of the sheer number of patients that we have and the demands on staff and the workforce, it's not always possible as much as we would like it to be. I think it's really important for patients to be informed and to kind of to stay in the know about what the latest developments are with their eye condition, and there's lots of great resources at their disposal. I mean, I talked about again, but their opticians are a great first point of contact who often have information about the latest developments, and opticians are required to stay up to date with latest developments through education. GPs are a great first point of contact as well, but also because of the internet and because of a lot of great organizations that have been set up to support people with sight loss depending on what eye condition they have. You have the IGA, which is the International Glaucoma Association. You have Retina UK, which specifically deals with patients with retinal conditions, and you have the Macular Society,
Yes.
as you've already
So
mentioned.
there's quite a lot of information out there, isn't there?
Absolutely, absolutely, and it's all at your fingertips because of the internet.
Yes.
And so, just like we're doing this on Facebook Live at the moment, all of the and so I would probably say these societies, these charities, these support groups that have been set up specifically for patients with certain eye conditions,
Yes.
they're a great first point of contact to find out about the latest research.
Yeah.
And then if patients find something that they think is applicable to them, and they want to know if Moorfields is something that is offering it, or there's research happening by Moorfields that they could potentially access, then please ask your GP to refer you back to us, and we'd be happy to see you in clinic again.
Fantastic. Thank you, Hussain. I think Catherine has some comments first. Do you have?
Well, it's more, I know we sent you some comments from some of our members and we haven't got round to them yet, Hussain. Could we move on to those ones? Because we've got someone...
Yes, absolutely. Yeah.
Thank you so much.
Yeah, happy to move on to those questions.
So I haven't got them in front of me. If you could...
Oh, right. Okay, fine. So I've got them in front of me, thankfully. So the first one is why does it take a long time to receive an appointment? And it's a good question. I mean, hopefully we've touched on a few of these.
You did, yes.
Already. So especially in light of context, we've had to be very careful about how we manage patients' appointments. I mean, and we've had to prioritize patients and categorize them into kind of low and high risk. But be assured that if we've cancelled your appointment, it's after diligent review by a doctor or by a clinician. And like I said, if you do, and that doesn't mean that things can't change. And so if you do feel like your eyesight has changed or your condition has changed, please either contact us or see your local optician. And if there is an urgent problem, then they can highlight that to us, and then we can see you again.
Thank you.
So absolutely, yes. I mean, unfortunately, because of the current climate, that's why sometimes appointments are being delayed. I've got another question here to say appointment letters have initials and it is not clear as to which Moorfields hospital they refer to. Could this be looked into, please? Absolutely, yes, it can. In fact, I've already raised this with our administrative teams. We'll have a look at what that actually specifically refers to. I mean, my understanding of our appointment letters was that the address of the hospital or site that your appointment was going to be at was printed on the top left-hand corner of the letter rather than in initial format. But I've raised this with the administrative team, and if there's room for improvement, we'll certainly be looking to change that.
Thank you.
So can glaucoma patients make appointments by telephone? Yes, they can. I'm happy to put in some details. I mean, I've got some details specifically for Moorfields at Croydon. There's the Croydon secretary's phone number that I can give you, and if it's easier to make an appointment by telephone, you can call that number, speak to one of the Croydon secretaries, and they can look into making an appointment for you within the service.
That's fantastic, Hussain. So Hussain, do you have that phone number at hand?
Yep, I can say it for you now, Catherine. It's 0208
Catherine
401.
Sorry, Catherine is typing it out. 0208
401.
Yeah.
3128.
Brilliant, thank you very much.
Thank you.
And that's specifically that's the Moorfields at Croydon secretaries.
Secretaries, fantastic. Thank you so much.
Okay. So the next question was, I had an operation 2 years ago and was discharged. How would I find out if there is a procedure that could restore some of my sight? Any recommendations on what I should do, please? It's a good question. I mean, without knowing what the operation was or what the condition is, it's hard for me to advise specifically. But again, your optician is a good first point of contact. So, and especially if it's in Croydon, because like I said, in Croydon, we're fortunate enough to have good links with the local opticians. And so if there is something, then that your optician feels you could benefit from, then they'll certainly refer you back to us. The next question is, I feel that I'm struggling with my sight on a daily basis. How do I find out if I can qualify to register as a blind or partially sighted person? That's a really good question. I think it's important to remember that there are eligibility criteria to become registered as sight impaired or severely sight impaired. The RNIB website is a good resource and quite clearly has the criteria on there. And they put it in language that is easy to understand. I think to know whether you meet that criteria, it's worth a trip down to your optician to say, look, I'm specifically concerned about this, and can you please test my eyesight to know if I'm eligible? And if you are, then they can refer you into Moorfields or another eye hospital or eye unit that can start that process off of certification and then registration. I think it's really important to highlight that you don't necessarily have to be certified and registered as blind or partially sighted to access services from social care.
Yeah.
And the RNIB also has important information on their website about how you can access those services and self-refer.
Hussain, if somebody wants to be certified, they do have to go to a hospital, don't they?
Yes, they do. At the moment, the current arrangements are that only a consultant ophthalmologist or a consultant eye doctor can sign the certificate of visual impairment. So it does involve a trip. If you've been discharged, then being referred back into us. If you're already under our care, then at your next appointment about inquiring about eligibility for certification.
Yeah, thank you.
Okay. So the next question is, I was diagnosed with a retinal dystrophy some years ago. How do I find out about new treatments or procedures? And is this something that Moorfields could assist with? Hopefully what we discussed previously will answer that question.
Yeah.
I mean, Retina UK is a good organization. And especially if you have a retinal dystrophy, then the Macular Society obviously deals with macular-related eye disease, which is the macula is the central part of the retina. So if you have a retinal dystrophy, then Retina UK is a good first point of contact. The RNIB, and just a Google search. I mean, a Google search of your condition can kind of point you in the right direction.
Yeah.
If you have family around, if it's difficult to access the internet, then if you have family that can support you, or Croydon Vision can support you with that.
We can, yes, we can.
If you're looking for something more specific, then you have the Moorfields Direct Helpline. That's a nurse-led helpline, and they can direct your query to the medical retina service if you feel like there is something out there that could benefit.
Hussain, the helpline, is that the one you gave us before?
No, so that is the number that's specific for the
Croydon Moorfields
team at Croydon.
Yeah.
If you want the helpline, the Moorfields Direct Helpline,
yes, please.
I will try and get that for you.
It'll probably be quite useful. Yes.
Yeah, absolutely. No, I'll try and get that for you as I'll try and multitask as I'm answering.
I found them. I googled Moorfields helpline. And it says General Ophthalmology Moorfields Eye Hospital. Is that the right one, or is there a different one?
There probably is a different one.
I will let you look because you'll have an idea.
Yeah, no, don't worry. I will get that for you. No problem. I'll try. Like I said, I'll try and multitask.
We all do. We all try.
So yeah, okay. So the next question was, 15 years ago, I was offered a treatment, an injection in my eye that would make my eyes turn yellow. I'm not sure what kind of treatment this would have been. Are there any injections that you would be able to explain that causes the eye to turn yellow? Again, without knowing the specifics about what this is, it's difficult for me to comment. I mean, I'm not aware of any treatments that make your eye turn yellow. I am aware of not a treatment, but it's a procedure. It's a diagnostic procedure, an investigation, a certain type of test that we do called fluorescein angiography. Now, fluorescein is a dye that we inject into the eye to circulate around the blood vessels in the retina to help us see how well those blood vessels are functioning.
Yeah.
And so that dye is yellow. And so that could be what you mean. That's the only thing that came to mind when I read this question.
Yeah. So would it then disappear? Would that dye sort of leave the eye?
Yes, absolutely. Yeah. So the dye leaves the eye and comes out of your body when you go to the bathroom.
Yes,
So when you go to the toilet, that's how it leaves your body.
So
it doesn't stay in there for long, over about a period of about 24 to 48 hours.
So the yellow is to check the blood circulation in the eye.
Correct.
Yeah. Okay.
Specifically for retina and macular conditions, it's called a fluorescein angiogram. But like I said, that's not a treatment necessarily. That's more an investigation. It's a test.
Yeah.
So the next question is, Moorfields Eye Hospital did a first in human phase clinical trial of raft aniridia related keratopathy. I can explain what all these terms mean in a moment. After the raft procedure, how long does it take for the patient to show the benefits of the treatment? In the video seminar I watched, a consultant, Mr. Sajid Ahmed, his accompanying talk seemed to suggest it could be up to 5 years. If so, why does it take so long to know the results from the trial? So I had to do a bit of research about this because I wasn't really aware. I mean, aniridia-related keratopathy is a very specific and quite rare condition. Mm-hmm. And there is a trial currently underway to test the effectiveness of this treatment. It's a tough question. I mean, the thing about clinical trials is that they often span a number of years, and that's because sometimes the effect of treatments can be very slow and gradual. And so you need to give it that time to know what the maximum benefit is, because if you stop a trial after a year, you might not know whether the trial is continuing to be effective years down the line, because sometimes the effect is very, very gradual.
Or you don't know there might be some secondary effects that you're not sure
of. Absolutely. Yes. That don't come until a lot later.
Yeah.
If it's a novel treatment, if it's a very new and an innovative treatment, it might be uncertain as to when the effect might actually kick in.
Yeah.
It might not be immediate. The effect might kick in a year, 2 years, 3 years down the line.
So Hussain, if somebody wanted to know about a research like that and the progress and what's happening, are we able to kind of sort of access them online? Are there like reports? Where would one go?
That's a good question, and that I'm not entirely sure about where you would. I can certainly try and find that information out and feed back to you guys at Croydon Vision, so you can.
That would be really good, because like that we can pass it on.
Yeah, I mean, absolutely. I can try and find out where you would find information about some of these. The thing about trials that are still in progress,
you wouldn't have a report yet.
You don't really have a report yet, and so you have to wait for the trial to finish before preliminary results are published. And then obviously again, it takes a long time to publish the results, because you need time to analyze the results and then write the report, and then there's a whole bunch of regulations that you have to comply with. So there's absolutely as soon as the trial is finished, some preliminary results should be published, but I will get some more information about where you can find information, or where public information is available, and I can feed that
That'd be
back.
fantastic. That'd be really good. Thank you.
Right. Okay. So let's see if I can find.
The nurse. Oh no, it was the helpline of Moorfields, was it?
Yeah.
Moorfields
Yeah.
direct helpline. Yeah, absolutely.
I'm looking at time and going, good grief, it's gone so quickly.
I know. I think it's be the last thing. We're going to wrap up. Yeah, we're going to have to wrap up. So while Hussain is looking for the number, well, viewers, I hope that you enjoyed this session, that you found it informative and interesting. And next week we have Nadine and Glenn and other volunteers. It's be all about volunteering, why you volunteer, the benefits of volunteering, and people's experiences at volunteering for Croydon Vision, and all the kind of how do volunteers help here at Croydon Vision? What does it mean for us? So I hope you'll join us next week and that you'll enjoy it. And in the meantime, we're still waiting for the number, I think.
Yeah.
And it's okay. And also remember that all our videos, all our Facebook Live, our videos, and amazing and interesting podcasts as well, all go on our C-Hub. I think Ola gave you a tour last week. If you are struggling to find things on a C-Hub, don't forget you can call us, you can email us. Catherine and Ola are here to help you navigate our website. And if there are things, if there are topics or information you'd like to see, that we're not doing, do let us know, because we're always there taking your ideas, your comments, and in the end, it's information for you as well. So do let us know. Do type your comments, your requests, and anything that you want, really.
And just while we wait for Hussain to do a little bit more of that, we might have to get it off of you afterwards if you can't. But we've got, thank you so much for such a great session. And also can you do another one? So definitely you're going to hit with our members. And the last thing, one quick question that's come from Glenn. Allegedly in America, they've done a retina transplant. Do you know if that's correct?
I don't. I wouldn't be able to verify that for you. Sorry, I'm afraid. I mean, I know it's still a retinal transplantation, and it's still very, very early days, and I think we're still a way off that becoming available as a mainstay treatment.
Yeah.
I think there have been trials in the past, but whether it's been successfully done in America or not, I wouldn't be able to tell you.
Yeah.
But in terms of, and as far as it being available, kind of more widely, I think we're still a fair way off that.
Yeah.
That's okay. So we've got to finish now, but when you find that number, Hussain, just send it to myself or Natasha or Odette, and we will just make sure everyone here knows about it, and we'll share it on as well.
I've just found it.
Hey, excellent.
So this is the Moorfields
So
helpline.
it's 0207 566 2345.
Moorfields helpline that was, wasn't it?
That's the Moorfields direct helpline, yeah.
Fantastic. That is so helpful. Thank you so much, Hussain, for joining us and for sort of giving us all this useful information about Moorfields and eye health. Thank you. It was really great.
Okay. Thank you for having me.
Bye-bye.
Bye.